title of today's webinar, Take Advantage of the Market, Start a Business in Healthcare. Healthcare is going crazy right now with the amount of money that's being spent. And if our licensees can just get a teeny tiny little piece of that pie, they can do really, really well and make a lot of good money running this business. I wanted to show you this quote here. This is a new edition of a book that we've shown on this webinar before. But it's basically, if you guys are looking to start your own medical billing service and you really don't know how to go about doing it, and maybe you don't have the capital to invest to go through a program like ours, you can go to Amazon and download this book right now. They actually mention us in the back as a reference for those who may not feel comfortable going out on their own and doing it all by themselves. They suggest, hey, if you need a network, of a company that can help train you and help you with the marketing and help support you in every way, contact American Business Systems, and they actually list us in the back of the book. So go out to Amazon and check that out. But look at this quote: by 2024, healthcare spending will total $5.43 trillion and account for 19.6% of the gross domestic product. Healthcare is big business. Its growth shows no signs of slowing. This makes it the perfect time to start your own medical claims billing service. So there you have it right there. Third-party verification on this industry. I mean, it's just staggering the amount being spent in this industry. Let me show you this next slide here. This was actually shown on the webinar last week, if any of you guys were on the webinar last week, but I wanted to I really appreciated it because it really drives home what your potential piece of the pie is. Okay, so this is the overall pie chart for just healthcare spending in general. This is the one that you want to focus on, physician and clinical, which is 20% of that $5.43 trillion. What does that come out to? Your piece of the pie? It's only about $1 trillion. Sorry about that. But that's the one that you want to focus on. Look, even this home healthcare thing, if you guys are researching other opportunities in healthcare, there's a lot of up-and-coming home healthcare franchises. There's all kinds of opportunities in these other pie sections here. But why would you want to spend 10 times what our investment is to get a home health franchise when it's only 3% of the overall pie? I mean, it just doesn't make sense. This is what you want to focus on right here, because this is where we have the most services that can help with this area for doctors, for private practice doctors. Take a look at this quote right here from the New England Journal of Medicine. The quote is, market analysts estimate that 24 cents out of every dollar are wasted on administrative and billing expenses. Now that's talking about specifically practices that are trying to manage their billing and other things in their offices. So they've got all kinds of enormous costs involved in doing that. And the thing is a lot of doctors just don't really realize what their true costs are until they talk to one of our licensees and do a consultation where we actually do an analysis of their practice and help them figure out that they're actually spending a lot more than they thought they were doing it in their offices. So we actually have ways of educating them and showing them in writing what's going on in their practice. Here's another good quote from, I'm just going to call him Dr. Vern. He says, I have to pay about $20 in admin fees to collect from the insurance company. So between the person that bills, the computer system, the ongoing support, it costs him about $20 per insurance claim. So every claim that he sends, it's costing him about $20 to get collected to collect the funds on that insurance claim. So it's a big problem for them, and they realize more and more as they start being educated by our licensees. They start realizing, wow, I didn't know that I was paying X amount of dollars to have it done in-house. Here, take a look at this. This is an annual cost. This is just an example. This is some numbers that we got back from an actual licensee who did a practice analysis. So for the doctor that was doing the billing in-house, you want to look at that, in-house, they had basically paying 1.5 full-time employees that much. You've got payroll taxes, workers' comp insurance, another errors and omissions insurance, training, leave coverage, employee benefits, hardware, software, IT support, $3,000. So the doctor was paying $65,000 a year to do the billing in-house, when the only cost they had to outsource to one of our licensees was 6%. per claim, which comes out to be about 31 grand a year, for an average claim dollar amount of $100. That's what that number is. So you can see that as you start doing that in the analysis of the doctor's practices that we teach you how to do, it's very easy to come back with numbers and show the doctor or the office manager and say, look, based on the information that you gave me about how you're doing things right now, we can save you this much money by outsourcing to us. So you're not having to try to do a hard sell on them at all. You're saying, look, it's obvious that we can definitely save you money here. So, when would you like to sign up? And the key is just to do proper follow-up with that person until they're ready. So that's kind of how that works. Let's see here. Here's another quote from blackbookrankings.com. They actually do a lot of different healthcare surveys. They survey physicians and hospitals and employees and all kinds of stuff, all different aspects of the industry. But they did survey physicians who had a practice which was, a smaller practice, a 1 to 5 doctor practice. Are you planning to outsource anytime soon? And the results were that 42% of the smaller practices reported, yes, we are planning to outsource our billing in the next 12 months. So there's another really big indicator right there that this is the perfect time to get into this business. Here's another thing that's happened right now. Millions have been covered by the Affordable Care Act. So what does that mean? That means that there's more people going to the doctor, there's more insurance claims, there's a higher volume of claims to be processed. So not only is there a higher volume of claims to be handled and managed, but look at this. There's another quote from the Association of American Medical Colleges. They are forecasting a physician shortage. There are fewer and fewer doctors that are graduating and going into general practice. And there's going to be a shortage of doctors over the next decade. So the ones that are in practice now, they're going to be even more stressed and under more pressure to see more patients as quickly as possible. And it's just going to be next to impossible for them to try to practice medicine and worry about managing, getting paid, claims, and all this other kind of stuff. So basically, if you can get just a certain aspects like billing out of the office, then usually you're freeing up the doctor and the staff to do everything else that they have to do on a regular basis. Because if you've ever been to the doctor lately, there's stacks of paper all over the place. There's people running around all over the place. Usually you're not seen in a timely manner. I've had to wait a long time when I've gone to the doctor to be seen. Even if I show up, well before my appointment time, I'm the one that has to wait. It's like, it's not fair to the patients. Here's another thing. 10,000 baby boomers are turning 65 every day. Now, I've heard that, when you turn 65, things stop working. I don't know if that's true or not. I'm not there yet. But that would indicate to me that people are going to start going to the doctor. The baby boomers are more and more going to be going to the doctor, which means more patients to handle. So you may be wondering, how do you fit in? How do I fit into all of this in the grand scheme of things? Well, what American Business Systems does is we train and certify you as a medical revenue manager, a CMRM. And this is a very important distinction because you are not just going to learn about medical billing. You're going to learn about multiple aspects of a doctor's revenue cycle. So we actually have services that can help them with not only insurance claims, but also patient receivables, money back from the patients that wasn't covered by insurance. We have an electronic medical record system that the doctors love, which I'll show you in a moment. Different patient payment plan options. We have a medical coding service. We have audit protection services for them. That's another real big one that's going on right now is HIPAA compliancy. They're starting to fine doctors left and right for not being HIPAA compliant. Same goes for the coding. If Medicare comes in and does an audit on a doctor and they're not coding properly, whether or not they were doing it on purpose or not, they could get into big trouble. So we have services that help them with that. We also have marketing tools that you guys can use to market your business that you set up, and also marketing tools that doctors can use to help bring in more patients. So we've got all kinds of good stuff that I'm going to talk about. this is kind of what your role is with regard to the insurance claim filing specifically. This is the revenue cycle management. So as a medical biller, as you start a medical billing company, the medical billing service that you offer, you're going to be dealing with claims preparation, which really involves the patient registration and eligibility, which is going to be handled mostly by the front office staff. So that's the first part. The claims submission is actually going to be done by you, and then the claims management is also done by you. So you're going to be handling the incoming information back from the insurance companies that tell everyone what was paid, what wasn't paid, and we're going to teach you how to do all of this in our training. It's not nearly as difficult as you might think. And then what you can also do as far as reporting is we have a very robust reporting functionality built into our system, so that you can provide reports to the doctors and show them exactly what's going on at any given moment. And these are real-time reports. So in other words, not only are you delivering these to the doctor, but they can log in 24/7 anytime they want to and see exactly what's going on with their claims and see where their money is at. And that's a big deal because a lot of doctors who are, have used, some of them have used outsourced medical billing before, but the company had older technology that wasn't web-based. So you have to make that distinction there, because with your web-based system that you have, they can get on 24/7, they can log in from the golf course, they can see their schedule, they can do e-prescribing from their iPhone, they can use the iPad for the medical records. It's very, very cool, very easy to use, and they feel like they still have control. That's the big thing, is they can see exactly what's going on. There's full transparency is my point here. So again, as a reminder, if you guys have any questions, feel free to type them in there. We've got some questions coming in that I'll address here in a moment. Yeah, just start typing in questions, and as I go, I'll start answering those. All right, so a lot of you may be wondering, well, how much can you actually earn doing this? If you guys have not seen our income calculator, don't do it right now, but when the webinar is over, go to avsystems.com and click on income potential up here, and there's a couple of different calculators that you can play around with that are actually pretty interesting, and you might be surprised what you might find. So here's an example of one. Now, these numbers were given to us by a licensee, and this is an actual doctor scenario. So this is a licensee signed up one doctor who, is just a general practitioner. So they saw about 20 patients a day, and they were open 5 days a week. And this licensee was charging 6% per claim, and the average claim amount for a family practitioner is pretty small. It's around $100 typically, which is an important point to note. So this is a very low amount of income that you can make, because the claim dollar amount for the doctor is pretty low. Now, if you actually started signing up specialists, which, by the way, this system that we have works for virtually any specialty you can think of, you're obviously going to be making a lot more money, is my point. So, but if you go around and go to that income calculator, type in those numbers, click on that submit button, here's what you'll see. You've got a total yearly gross income of $31,200 per year. Average monthly gross income is $2,600 a month. That's to you, the licensee. That's gross income to you. Okay? So get a load of this. It's $2,600 a month. That's for billing only. That's for the iClaim service only. All right? So as you start offering some of those other 8 streams of income that we have, you're going to have multiple streams of income coming in every month. And we've actually designed the majority of our services have a residual monthly income that come in. A couple of them are just a one-off, you make money on a one-time deal, like the audit service that we have. But a lot of the stuff is ongoing residual, which is exactly what you want in a successful medical billing business, residual income. That's where it's at. So that one doctor you sign up, you're looking at $31,200 a year in gross revenue. That's one doctor. How much time do you think it takes to manage that one doctor? Well, we have licensees right now that tell us, you know what, I can deal with one claim, I can process one claim in about 2 minutes. That's it. So, the average family doctor sees about 20 patients a day. So when it's all said and done, you're looking at about an hour of work a day for that one doctor. So who on this webinar would be interested in working 1 hour a day for $31,000 a year? I would. And that's just one doctor. Our licensees that go through our training right now, they are getting their first client, their first doctor signed up in an average of about 60 to 90 days after our training class. That's the average time to get a first client. But what usually happens is, once they get that first client, they start getting referrals from that doctor. And these could be doctors in any part of the country. You know, I don't know if you guys are aware of this, but this is not a franchise model. There are no restricted territories. So you're able to take referrals and take clients from any part of the country, as long as they're in the United States. That's the only requirement. So you could literally have clients in any part of the U.S. And just be making, you know, roughly this amount of money for each doctor that you sign up. So if you were running this business by yourself, you know, you could probably have 5, 6, 7 clients before you would have to look at bringing on someone to help you with the data entry part, which, you know, we'd be happy to talk to you about that and how to set that up. But yeah, I mean, you'd be making 6 figures at that point with just a handful of clients. So it's pretty amazing. It can be pretty lucrative if done properly, and that's what we help you with. So I mentioned other streams of income. I'm going to go through a little bit and talk about some of the main services that are really having a big impact on the doctor's revenue and licensees are very successful with. But there's some of the stuff that I mentioned earlier. The auto card system is the marketing system I talked about. Quick Collect is a collections service that collects on past due accounts. But the cool thing is we have a technology partner that actually does the work for you in that service. So you're able to offer a collection service without you having to ever do any phone calling or letter writing or any of that business. We have someone that does that for you, and you get to make money on the money collected. We have the electronic medical record system that I mentioned, the AUDITGUARD service, which helps protect from different coding issues that doctors might have. The CODERITE service is actually separate from the AUDITGUARD service. That's more of a one-off. Let me get back to CODERITE. Let me talk about iDocs now. That is an online document storage and archival system. So we're actually able to. There's a lot of doctors still that have rooms full of paperwork that they don't need to access. You know, they basically just need to store it somewhere. And a lot of doctors are using, you know, warehouses and all kinds of stuff to store all of this paper. Well, instead of doing that now, we can go completely paperless if the doctor would like to. We can scan all of their historical files and get them archived and indexed, put them up in the cloud. You guys have heard about the cloud. So it makes it to where, you know, if they've got a room full of filing cabinets, they can actually get rid of those filing cabinets and free up space to have maybe another exam room, for example, so more revenue for them. So that's been a great service. ChoicePay is a service that allows patients to pay what they owe through like a credit card or a bank account or something like that. And then iClaim, of course, is the main medical billing system and service. That's what you'll be calling it, is you'll be marketing the iClaim service, and that's for, you know, helping with the insurance claims. So back to CODERITE, real quick. A lot of you on here might think, well, you know what? I'm actually going to get to that here in a minute about the coding. So let's wait till I get to that slide. Let's talk about iClaim real quick, though. Here's a quick look at our brand new, updated, high-res flyer. This is a flyer that we give to you as you get as part of your package, and it talks about the service and how it's going to help the doctors in several different ways. And what we do with all these marketing materials is we actually customize these. Okay, so whenever you get back home from our training, we actually do a session in the class where we help you name your business. We have a brainstorming session on naming your business because, again, this is not a franchise. So everybody that goes through our program, we call them licensees, and it just means that you're licensed to offer our branded products and services as your own. So we take your brand, okay? We take your name, your logo, your phone number, your brand, and we print it on all of these materials that you get. So you get these very high quality, printed on thick, glossy paper, flyers. There's also postcards, there's books, there's DVDs, there's all kinds of stuff that we've put together for you to be able to market to doctors. And so what it does is it really sets you apart from the competition. It really sets you up to look completely professional. And even if maybe you are working out of your garage, you know, in your underwear, the doctors are not going to have any idea that you don't have a big office somewhere. You're going to look like a pro, and that's what we do. We make you look like a pro. So iClaim, that's our cloud-based billing system. I mentioned that it runs on any computer. The doctors don't have to upgrade anything. If they have computers with internet, that's it. That's all they need. They can get on the system. They can use Macs or PCs, laptops, whatever they want to do. They really enjoy using the iPad for the EMRX service, though, that I'll show you here in a moment. But it's let me read you this quote. Industry experts have found that the average number of rejected claims for medical practice averages around 35%. So some guy named Dave said that, and so it's got to be true. No, really, I don't remember who that guy is, but that's true. That's what we found. We have asked all of our licensees across the nation, and we actually receive the practice analyses when our licensees are doing those for doctors. They send them into our support team, so we actually see the real numbers out there. And every single practice analysis that we get, we see, you know, what is your current rejection rate? That's one of the questions that we ask. We see 10%, 20%, 30%, 40%. I mean, it's crazy the amount of rejected claims that doctors are seeing right now. And it's because there's so many different types of technology. There's older software that doesn't get updated. Some doctors are still filing on paper, believe it or not. I know it seems hard to believe, but when you take all of that into account, that's where you come up with the average of 35%. Well, with our system, if we can get a doctor to use our full-blown iClaim and EMRX system in conjunction with each other, then what they'll see is an average rejection rate of less than 2%. We see that all across the board, which essentially means 98% of their claims are paid on the first submission. You know, when you share those numbers with a doctor, they're going to say, yeah, I'm going to need you to go ahead and prove that to me, so let's see what you can do, because that's almost unheard of in the industry. Very, very good numbers there. The system that I mentioned that is tied into the iClaim system, integrated fully, is this EMRX program here. And this is the electronic medical record solution that doctors use while they're in the exam room treating the patients. Okay, so basically we have completely eliminated paper. It's a totally paperless system now, no paper. So the doctors, instead of a clipboard or whatever they're used to doing, they can actually just walk in with an iPad in their hand, and they can, you know, hey, how you feeling today? Why are you here? You know, and go through the visit with the patient on the iPad. And what it does is it allows them to have a much better interaction with the patient. They can sit right across from them. They can keep eye contact, you know, while they're doing, you know, touching the iPad and the different medical codes and things that are on there. It's much better than, you know, if you've been to the doctor lately, a lot of them have a PC in the corner of the room, so they're hunched over the PC and they're like asking you questions and they're not even looking up from their screen, you know. So the patient kind of feels like this is kind of bogus, like I'm not really happy with this interaction. The doctor's not even really interacting with me. So that's why they love our system. It runs natively on the Safari browser in the iPad, and so they love it. It has a couple of really cool features, like it does full dictation with the Siri button. It can take pictures and add them to the patient's chart from the iPad, so it's very, very cool. Which, by the way, we'd be happy to give you guys a demo of this system. If any of you would like, just let us know and get with your ABS business coach that's been emailing you, and we can do a demo and show you how the system works, and it's really cool. Here's another screenshot of what the doctors see when they're dealing with the patients, and basically it's just allowing them to, you know, do the entire chart. You know, it's like instead of a paper chart where they're flipping through the paper like they used to, it's all on the screen now. And it looks great on a Mac, like you see there. It looks great on the iPad. Any device that they have, it resizes and looks great on any device. So it's very user-friendly. It's the most secure and certified system out there. Basically, the fact that it's cloud-based allows us to be very proactive in doing the updates and maintaining the security for you. And that's very, very important to us because, you know, patient data is there. You see all kinds of things in the news about a lot of the non-web-based systems, the systems where the doctors had patient data on an older system actually residing on a hard drive or a laptop or something in their office. And you see all kinds of things in the news now about a laptop getting stolen or a server melting down or getting stolen or whatever. And they can get into big trouble with that. So with our system, none of the patient data is residing on the doctor's computers. None of the patient data is residing on your computers at home, which is even more important. We actually have this is kind of crazy. So we have multiple servers, redundant servers is what they're called, on different parts of the country. So we have some on the East Coast, some on the West Coast, and they're even on different power grids, okay? So if one power grid went down, one server went down, you guys would still be up and running because of the redundancy that we have in place. So it's as secure as it gets. It's the same type of security they use for online banking, certified for, anytime the government, comes along and says, well, now you have to do it this way instead of this way. We've already done that update for you. You never have to worry about installing anything. It's just done automatically. Same goes for the codes. When we talk about the medical codes, there's different codes for each medical procedure and medical illness that's out there. We maintain those databases for you, and anytime there's changes or updates, we do that for you. So very, very cool. As I mentioned, it's designed for iPad. Here's a screenshot of kind of what it looks like. Doctors love using the iPad because they don't have to use their finger. Of course, it's designed for touch, but if they want to, they can use the Siri functionality to talk directly into the microphone on the iPad and do dictation if they would rather do that. They can also, of course, pull up a keyboard if they would rather type, because the iPad does have a keyboard that comes up. So let's see. So it also has a real-time reporting built into it, and this is the reporting, kind of what I was talking to you a moment ago, where the doctors can at a glance see exactly where their money is at. They can see, split it up by insurance payer and see what insurance companies are paying the fastest, which ones are being, the biggest pain in the butt, whatever they want to see, they can see it on here at the click of a button, which is very handy for them. And also, when it comes time to invoice the doctor for your billing services, that's another question that you may be wondering is, how do I get paid? So we actually recommend that you invoice the doctor using a separate system, an accounting system like QuickBooks or something like that. But you can get all of the numbers that you need. You can get the net receipts report out of the system very easily and attach that with your invoice so that you and the doctor always know, exactly what's going on and what money is owed to you, what money is owed to the doctor. It's full transparency in every direction. The service I mentioned a moment ago, Quick Collect. Here's a Quick Collect flyer, but as I mentioned to you, it's helping collect on past due accounts. Look at this quote here. Physicians typically collect only about 50% of outstanding patient balances, resulting in almost $60 billion in bad debt. See, a lot of doctors would rather just write it off, so it's not a service that they have to use. But if they do use this service to collect, on past due accounts from patients, they can actually increase their revenue quite a bit. So that's going to be an optional service that they can use or not use. Which, by the way, this is one of the few services that we have that can also be offered to any industry. So it's not limited to just medical. So don't even limit yourself to just the medical community. Not only are you not restricted by territory, but you can go outside of the medical community for some of these services that we have, and this is one of them, Quick Collect. CODERITE, I mentioned the CODERITE service. This is for if a doctor says, you know what, I have a lot of code that I'm trying to manage, and I would like someone to help me make sure that I'm coding properly. This is where you would say, okay, great. We are certified in ICD-9, ICD-10, and we can help you code those claims properly. And so how it works is we have certified coders that actually do the work for you, the licensee. And you can charge the doctor a fee, an extra fee on top of the percentage that you're charging for the billing. $5 a claim, for example. I'm just throwing a number out there, but that's kind of typically what our licensees are doing. And it's per claim. And the cool thing is you guys, you go through 5 days of our training. That's it. It's a 5-day training class that we do, and you can immediately start promoting yourself as a certified coding company. So you yourself, you don't have to know much about coding at all, and you certainly don't have to go through 2 years of coding school to get that done either. So it's very helpful for licensees who want to kind of fast track and just start generating revenue as quickly as they can. You don't have to spend years and years going to school first. So it's been very handy there. We do have a couple of questions that have come in here. Let's take a look. Val is asking, what's the average length of time you've seen that a licensee has obtained a client after being trained? Well, hopefully I just answered that. It's typically the licensees that do this full time when they get back home. This can be done part time. Don't get me wrong. We have licensees that have full time jobs, and they have to do this part time in the beginning. And their plan, of course, is to get a couple of clients and then quit their job as soon as possible. So that is doable. But the people that do this full time right out of the gate, it takes about 60 to 90 days, sometimes longer. It just depends on your time and effort that you put into this business, but that's about the average. So hopefully that helps there. Sammy is asking, what about hospitals? I don't understand the rest of that question. Sammy, if you could maybe reword that question, I'll be happy to reread it. Let's see, how does the system help the doctor with coding? Okay, hopefully I just answered that as well with regard to the coding service. Now, let me just put it to you this way, though. A lot of your clients that you sign up, they actually have a handful of codes that they use on a regular basis. So a lot of your clients that you sign up, they are making the determination on what codes they want you to send to the insurance company. So when you get the claim information, it's already got the coding already filled out for you. So that actually takes a lot of pressure off of you, the licensee. You don't have to do, there's not a lot of deciphering of coding and no decision making with regard to that. You're just simply putting in the information that the doctors give to you, which is great because your role is really more of a data entry role, and then of course doing the follow-up on the claim information coming back from the insurance companies. That's a big part of what our licensees do, is helping that manage the incoming, the claims coming back into the system. That's a big part of what our licensees do for doctors. So you don't have to know a ton about coding, and like I said, the codes are built into the system. So hopefully that helps there. Let's see. Michelle is asking, when billing the doctors, can I have them do direct deposit into my account? That's a great question, Michelle. Yes, we actually have a service where you can draft their account for your service fees, as well as the doctors getting paid from insurance companies. Typically, the insurance companies can put the money right into their account electronically as well, which is, it's good to make that clarification. You're not touching the doctor's money, and that's good. They're not touching, they're paying you directly. We're not touching your money. The doctors are paying you directly, and the insurance companies are paying the doctors directly. So hopefully I made that clear. But yeah, we keep everything very separate like that. Let's see. I got another question. Diraj is asking, how do we integrate doctor bills into the ABS system? Not quite sure. It sounds like you might need to get a demo of the system, Diraj, and we can show you the workflow and how that actually works. But essentially, it's just as I described it. The doctors are treating the patients with the iPad, and then the claim information is getting sent straight over to the iClaim billing system immediately in real time. And then the licensees are submitting that to the insurance company, and then the insurance company pays the doctor. So hopefully that answers that question. All right, so let's. Oh, do I need to know coding? I just mentioned that. No, you don't. You don't need to know hardly anything about coding the way that we have the system set up, which is very, very helpful for you. Look at this quote here from Mike Inger at Aviacode. The average physician could increase their billing, their monthly billing, by 30% if their medical coding was done accurately. Some of you may or may not be aware that there are different levels of coding that doctors can do for claims or patients based on what they actually did during the visit, during the exam and the visit. So that's what we can help with if they want to make sure that they're coding at the highest level that they can to get the highest reimbursement, of course, from the insurance companies. Then that's our CODERITE service can help make that happen. All right, so AUDITGUARD is a service that can help for, this is more of one of those one-off services that I was telling you about, where the audit is performed once and you charge the doctor a one-time fee for that. And so it's not an ongoing residual. I mean, we do recommend that you do this annually for your doctors. So you could have a once a year, scenario where you're doing this once a year for your clients. But basically, it takes a real detailed look at everything that a doctor is doing with regarding to treating the patients, doing the charts, doing the coding, everything. And it basically, your role in this service is simple. All you're doing is you're going to help gather up 50 patient charts and provide those to our certified coders that we have that actually take a look, and they do all the work. Again, this is a service where we have a technology partner that's doing all the work for you on this service. So what they're doing is they're using a magnifying glass, and they're making sure that the doctors are crossing their T's and dotting their I's and doing everything that they're supposed to be doing in a proper way, coding properly, et cetera, et cetera. And then they come back with a full report that shows an evaluation audit, and it's a very, very detailed report that shows if you make these changes and do this, 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 and this, then you will have a revenue impact of X amount of percent. Like, they'll actually show them the results. They'll show them how, what their current quality score is, how it could be improved, and how to basically maximize the reimbursement, as well as how to be protected if Medicare ever came in and did an audit. So this doesn't guarantee that they're not going to get any fines or anything, but if they've gone through this AUDITGUARD program and can have this evaluation audit certification that they can provide to Medicare, the chances of them being fined are greatly reduced, next to impossible. I'm not going to say it's impossible, but close to it. Okay, so that's what that service is. Hopefully that made sense. So those were just a couple of the services. We have a few others that I mentioned, but I wanted to talk a little bit about our proven marketing methods that we have. All right, so that is probably the #1 question that we get is, how in the world do I get clients? How can someone like me, how can little old me who's never been in this industry, maybe even never owned a business before or done anything, how in the world am I going to get a doctor convinced to do business with me? That's the #1 question that we get. So let me just say this. We have been doing this for a long time. As I mentioned in the beginning, we started in 1994. So we have been able to evolve and perfect our marketing methods over those 20+ years. And we have taken some methods and we've thrown them out the window because they don't work anymore. And basically, we have about a dozen different methods that we teach in our training class right now, and they are proven because we have licensees that are business coaches and mentors and trainers that help us and go out and test these marketing methods and help us make sure that they're working right and make any tweaks that we need to make sure that they're working the best way that they can work. Okay? So you got to trust us. We've done this before, and if you follow our marketing plan that we give you at the end of our training class, there's no way that you can not get a client. Did I say that right? There's no way that you can not get a client. You're going to get a client. That's my point. You're going to get a client if you do the steps exactly as we teach, okay? Because we've been there, done that, and we know what works. So here's one of the methods that we have: business networking. I don't know that I would trust every one of these people. Some of them look a little fishy to me, but you never know who these people might know. And that's what you're doing when you're networking, okay? Networking, some people have an idea of networking. Some people don't really know what it is at all. What you're doing is you're trying to form strategic partnerships, okay? So you're not going to different networking events and looking for doctors. That's not the way to do it. What you want to do is you want to look for people who maybe they work with doctors, but they don't do billing, okay? So let me give you an example. This guy right here, he's probably an IT guy, all right? I'm just assuming because he has a mullet. I don't know. But, he may work with doctors, but he just does IT stuff. So if you guys become friends, become strategic partners, he could send you business, all right? So one of these other people might be in real estate. Maybe they just sold a home to a doctor. And maybe the doctor was walking through the house going, well, I don't know how I'm going to afford this because my biller just quit or something. You never know. Some offhand remark where that real estate person goes, oh, you know what? I remember meeting so and so at a networking event. And they have services that can help. So that's probably the number one method, is getting what we call getting business from your warm market through referrals. So we actually get very specific on this method in our training class. We talk about different organizations to join so that you can go to breakfasts and luncheons and things in the evenings and weekends where you can start meeting with people and telling them who you are and what you do. And that's actually what we help you with as well in training. We help you work on what we call your elevator pitch or your stadium speech, so that whenever you go to these events and it's time for you to tell everybody what you do, you want to make a lasting impression. You want to say, you don't want to just say, well, I do medical billing, so if you guys know of anybody, let me know. No, you want to say, something that's going to get them to go, wait, what? He does what now? So that's what we help you do to make you stand out when you go to those different events. And that's been a very, very big lead source for our licensees. We have an automated follow-up system that helps you stay in touch with these people. So this is very important as well. When you go to these different networking events, you may be getting business cards or names and phone numbers, email addresses, stuff like that. You have to manage those properly. And we have a way to do that with our automated follow-up system that we have that we'll show you about when you come to the training. We also have educational marketing. Now, if you haven't picked up on this, what we do is, by the end of the 5-day training, and I know this sounds crazy, but by the end of 5 days of training, we teach you enough so that most of the office managers that you talk with, you're going to know more about the industry than they are. It's true. So what happens is you become, very quickly, you become the perceived expert in your industry. And it's, really, I think the quote is, you only have to know about 1% more than somebody for them to think you're an expert, which is fine. And so that's what we do. We give you the highlights of the industry and the talking points so that you can, come across as a trusted advisor and trusted expert. So part of that is educating the doctors on what in the heck is going on in their practice. So for those of you who haven't heard, this is a book that was written a little while ago, back about a couple years ago, by my dad. He actually wrote this. It's How to Get More Money Faster into Your Professional Practice or Small Business. So this was written as a marketing tool for licensees to use. That one works great and has a lot of good information in it, but that one was written for, it can be given to general business owners, doctors, you name it. It's not specific to medical. Now this is the one that you're going to want to read and take note of. This is the new Thriving Medical Practice book that was just released, written by my father, the founder of American Business Systems, and a medical doctor, Vicki Rackner. They collaborated on this book, and they were able to put together some very, very interesting, important information specifically written to medical doctors, private practitioners, on how they can not go crazy, in a nutshell. This is a really long subtitle here. How to get off the hamster wheel, work smarter, not harder, generate more revenue, and enjoy greater career satisfaction in the era of the Affordable Care Act. Okay? So, this is a book that we teach you in the training that, you don't just throw it at a doctor and say, here, read this and call me. We actually show you how to highlight different sections, different chapters with notations and sticky notes and different things like that, and say, you know what, when you get a moment, just check out this one chapter. It allows the doctor to not feel like they have to read the whole book, although if they do, they're going to get a lot of good educational information. But essentially, what this book is doing is it's marketing to them the whole time they're reading it, and making them realize that outsourcing their billing and some of the other things that they're doing is the way to go. Okay? So if you try to do something like this on your own, you don't have a book like that. I mean, this is really going to help you. The doctors are going to go, okay, this is not just another salesperson here. This is a person who really, they're the owner of this revenue cycle management company, and I think they can help me. They do a lot more than just billing. They're not just a one-trick pony like these other guys that come in and talk about medical billing. So we've got full color customized marketing materials, as I mentioned. These are what some of the postcards look like. So we've got flyers, postcards, books, all that other stuff that I mentioned, and all of this is fully customized. So we take your logo and everything, and your phone number, and print it on all of this stuff that you can use. And also, by the way, you get these physical postcards, but these postcards are also available in our auto card service that I mentioned. Okay, so what that is it's a web-based management follow-up tool where you can put a doctor on a campaign so that the system will automatically send out these postcards and different things to them in the mail automatically. All you have to do is put them in once and click a button, and they get an automated campaign so that you are top of mind. You want to stay top of mind for when a doctor is ready to do business. You know, they're not always going to be ready to do business right away. And so that's why using tools like this are key. They're very important. We also have a trade show display, 2 different displays that you can use to market your business. There's a full-blown booth here that you can see on the left with a podium. There's also a smaller tabletop version that you can get from us. And the only thing that you have to pay is you just have to pay shipping to get that booth sent back and forth to you. That's it. We don't charge any money other than the shipping cost to get that. So we have a lot of licensees that have used that at different events. And the thing is, you can go to an event anywhere in the country. There's no limit. So if you have a friend in some other state who says, hey, there's this medical expo coming up, maybe you should come out here and we should do an event. You can go out there and do it, and you can sign up clients that way. We have licensees signing up clients left and right from trade shows. Here's a picture of some of our licensees that were at a recent trade show. It's a great way to get leads and start putting them on that follow-up system and getting business the way that I mentioned. Some of you may be thinking, you know what? I've never done any kind of sales and marketing. I'm terrified of talking to people. That's okay. We have people all the time that go through our training that are of that mindset. They just say, you know what, I've never done any kind of sales or anything, and it makes me kind of uncomfortable. We have a sales rep program, all right? So we can show you how to find people in your area, or any area for that matter, who have actually been in medical sales prior and have a contact database of doctors and are completely, not afraid to talk to doctors at all. These kids seem pretty happy-go-lucky. It seems like they might be able to get some business for you. I don't know, but we've had a lot of success. Some licensees have several sales reps out there marketing in different states. So you could just expand your reach, even if you wanted to do some of the marketing yourself, but just get your name out there that much faster. You could utilize the sales rep program for that. So that's another method that we have. So it's all about consultative marketing. You're not going door to door, banging on doors, trying to sell something that people don't want. You are getting business through warm market referrals, trade shows, lunch and learn seminars, different things like that I mentioned, and you're consulting with them. You're saying, look, let's do a free consultation. Let me ask you a few questions about how you're doing things right now in your practice. And we give you the questions to ask. It's very easy. It's a practice analysis. Okay? So it asks some simple questions like, what is your current system like? Is it server-based, web-based? How many claims do you do per month? What are you currently spending? Et cetera, et cetera. So there's several different questions on there that help you uncover what might be the best thing best services to offer and the best way to improve their overall health of their practice. And so what happens is you actually send that analysis into our support team, and we take a look at that, and we're going to say, all right, based on the information that we see here, we're going to recommend that you offer these particular 2 or 3 services. You're never going to offer all 9 services. You don't want to do the shotgun approach. You're going to offer truly what you feel is going to be the best benefit to them, and we're going to help you figure that out. And then you can take that back to the doctor and say, here's what I'm offering. Now, the next step is very important. The next part of the sales process is we actually do a live demo of the iClaim system for you. And we do these for free. So for the life of your business, anytime you need help doing a demo for your potential clients, that's what we do. So that's the next part. So we actually do the full demonstration. Our demo team does that. We answer all their technical questions for you, and we're doing this on your behalf as if we're a part of your company that you've set up. So what does that do? That builds your credibility. The doctors can see that you're not working alone. They can see that you have support partners behind you. And of course, we're going to knock their socks off with the system because we're pros. I mean, we've been doing these demos forever, and we show them all the really cool features that a lot of the systems don't have. And you know, I can't tell you how many demos I've been on with doctors where I hear them go, "Wow, that does that? Like our system, I've never even seen that." So really cool that we do those demos for you. And then by the time the demos are done, we have already helped you put together your proposal, your agreement. We've helped you with your pricing. That's another important factor is every single potential client that you have, you're going to be priced differently. You're going to be somewhere in the range of around 5 to 9% for your billing service. That's what our licensees are charging right now. But we're going to help you, every single client that you have, every potential client, we're going to help you make sure that you're pricing yourself properly because you want to make sure that you're in the market in the right way. All right, so yeah, that's one of the features I was telling you about, that little screenshot there, is the instant eligibility check. That one actually creates a full-blown patient record in the system with a click of a button. So it's very cool, no data entry at all, and it greatly reduces the errors and different things like that. So again, if you guys want a demo of the system, just let us know. We'd be happy to do that. We've got some other questions here. Camilla says, does the license need to be renewed? That's a great question. No, it's not a license in a true sense. It's more just we're allowing you to market our services and products as your own. Excuse me. So no, there is no license renewal. I'll go ahead and just mention for those of you that don't know or didn't see, the price, the one-time license fee is $24,990. So that does have to be paid up front in full before you come to the training. But that's it. That's all that you pay us. You don't pay us any royalty fees. Everything that you make from the doctors you keep, and then like I mentioned, there's no territorial restrictions or anything like that like you have with a franchise. There's no support renewal fees, nothing. We actually make a little bit of money from the software company that we work with whenever you guys sign up clients. So that's the neat part because we definitely do have a vested interest in your success. And so we want to help you sign up as many clients as you want because we make a little bit of money from the software company when that happens. So that's a good thing. You want a company like us to have a vested interest in helping you. Richard is asking, how much does a license charge a doctor to set up, and what is the cost for EMRX per doctor? Okay, so we can get into the pricing, and we can get into the nuances of that if you want to offline. Basically, licensees are charging a setup fee and they're charging a percentage, and that's typically it. You have to realize, though, that you have complete flexibility because this is your business, so you can set it up in many different ways, the pricing, and we can help you with that. So some licensees charge a percentage for the billing and a flat monthly fee for EMRX, depending on what the needs are of the doctor and depending on several different factors. In other words, sometimes you can get away with just charging them a percentage for the billing and not charging them an extra fee for EMRX, and so they feel like they're getting something for free, basically, and it still works out for you, where all your fees are covered. So we can talk about that offline if that didn't make sense. But also, as far as the setup fee goes, our licensees right now are charging an average of anywhere from $3,000 to $6,000 for a setup fee, and we can help you figure out what's going to be the best setup fee to charge. But that's typically the range that they're in right now. So the doctor is cutting you a check for that amount up front for getting the iClaim and the EMRX system. So hopefully that helps. Richard's asking another question here. I've been looking at getting grants to do the billing, coding, third-party billing. Would your program be a good fit for me? Well, if you're talking about getting grants for paying the license fee, we have not had any success with that. The qualifications for grants are much, much greater than what what licensees are able to provide to get this business opportunity, so that has not worked out. But we do have some recommendations on other funding sources, so we can talk offline about that, Richard, at a later point if you want. Umar is asking, if a doctor has a contract with another company but shows interest in ABS and the contract will expire in 6 to 8 months, how do you deal with this situation? Well, that's a good question, and there's a lot of different scenarios there. What we typically see is the doctors, some of the doctors have been locked into a different EHR system contract, and so that's actually not a problem at all. So our licensees are able to go ahead and start doing the billing for the doctor using the iClaim system while the doctor continues using their current EHR. So they don't have to use EMRX. That's not a requirement, which is good. It allows you to be more flexible in how you set things up. So yeah, so in that case, they would just wait until their expiration date of their other software system, and then we'd be able to get them, integrated with the EMRX system at that time. So hopefully that helps. Brenda is saying, do you have people at training to talk about how they achieve success? Yeah, Brenda, we have got tons of licensees that you can call and chat with. We actually do have some licensees that come and help us with the training as well, so you can talk to them in person about the business. But yeah, I mean, probably your best bet would be to first just make a few phone calls to some licensees and chat with them over the phone before you come to the training. That'd probably be helpful, as you're doing your due diligence. Gregory's asking, what is the average cost for a sales rep? Okay, so that's a good question. Right now, our licensees are, there's a couple of different ways to set it up. A lot of times, you will give the sales rep most of or all of the setup fee that I just mentioned that they collect, so that the sales rep gets a bulk of that setup fee initially. And then also, a lot of licensees will give the sales rep a small percentage of the ongoing billing, like maybe 1% or 2%, something like that, as an incentive. And you can also set it up in their agreement to say, as long as they are bringing on new contracts, then that residual will continue. But if they stop bringing new clients, then that that has an expiration date, that residual. So again, our support team can help you. We actually have all of the sample sales rep agreements and commission structures and all the training materials for your sales reps. We have all of that stuff on our private licensee website to help you get it rolling quickly. So hopefully that helps. Vel is asking, can you have clients in more than one state? Yep, I mentioned that. There are no restrictions whatsoever. We actually have licensees that the bulk of their business is not even in their own state, just because of referrals that they got. So some of the references, if you get our reference list from one of our business coaches, you'll find that that's the case. They just started getting referrals from clients that they already had, and they were just referrals from a different, doctors in different states. So it's the sky's the limit there. Max saying, can you show an example of the software under another company name besides yours? Well, the iClaim brand and the EMRX brand, if that's what you're referring to, that is your brand. Okay, so you would be, you would create your own company name, your own entity, but as you're marketing and as these demos are being done, you are promoting this iClaim product and the EMRX product as your own. But as I mentioned, the marketing materials that you have for iClaim, EMRX, those will also have your logo and your company name and everything on the marketing materials. So hopefully that makes sense. Demesia is asking, could the system integrate with their existing EMR systems and or billing systems? That's a great question. And the answer is maybe. And I say maybe because a lot of the older systems, they're not as high tech as our system is, and it's just not doable. But what you need to do is you need to ask your doctor, is your system HL7 compliant? That's what you need to find out. It's called HL7. If their system is HL7 compliant, then there is a good possibility we could get it integrated with our system. And that's really the only question. So the answer is sometimes yes and sometimes no. But we do have a development team that can help make that happen. If at all possible, we'll do what we can to make it happen. Let's see. Diraj says, do you need any certifications before you start the billing? No. That's another good question. And that's it's kind of interesting. There's no nationally recognized accreditation program for medical billing and revenue cycle management. There's several different smaller organizations that do some type of certification here and there. But if you go through our program, our 5-day training, you become a CMRM, and you don't have to do any other certifications. There's no other additional training or schooling that you need to go through to start going out and signing up clients. And of course, there's no way that we can teach you everything there is to learn about this industry in 5 days, right? So what we do is we have set up our private support website so that you can go in and continue your education in any direction that you want to go, from a technical standpoint, marketing, whatever. You can continue your education as you are out building your business. And so it just works out much better for you, because you'll start generating revenue in about, like I said, in about 60 days after the 5-day training. So it works out really well for people. Hanny says, is there any licensee in San Diego, California? Can I get their number? Hanny, I'd have to look in our database. Get back with your business coach, and they can look in our database and see if there's anybody out there, and see if they would be willing to take a phone call. That's another question, because we're not a franchise, so everyone's operating their own independent private business. So the licensees have to volunteer to take phone calls. We can't just hand out names and numbers. But get back with your business coach. We'd be happy to look that up for you. Let's see. Demetia is asking, could the system work with chiropractic clinics? Yes. The system works for virtually any specialty you can think of. Seriously. So not only are you limited by a territory, but you're not limited by any certain specialties. You can go out and market to any private practice specialty you can think of. All right, let's see. So where are we at now? Somehow this slide went backwards. Hang on a second. Let me go to the next one. Okay, pricing and proposals. So this is another thing that we help you with. Here's an example of what we put together, what we help you put together. These are materials that we have printed and produced. That over here on the left, this is the actual folder itself. It is a very nice paper folder that we have put together with this information on the inside. We have all of this stuff already written for you. So we have the full proposal written, and all you have to do is fill in your name and your information, the services you want to offer. So it's dummy proof. You just go in and fill in your information, and we can help you with that. But it's a very, very nice looking presentation that will have the proposal. It'll have the different flyers in there for the services that you're going to be offering them. This is what the inside of the folder looks like over here. It'll have your business card. And this is very pro stuff. I mean, when you get this, when the doctors hold this in their hands, the weight of it, they look at it and go, okay, this company has spent some money on their marketing materials. They have not just printed out some crummy little flyer on their home printer at home. This is legit. So it's little things like that that really make a big difference and help doctors to realize that you're not playing around. You're serious. You're not just a fly by night mom and pop billing company. You're the real deal. So that's what we do. We help you promote yourself as that. Like I mentioned, we do the live training in Texas. The Dallas-Fort Worth area. We do it at the Spring Hill Suites. It's a 5-day class. No, you don't have to come to the live training, but you're missing out if you do, okay? I'll just put it that way. The trainings are held every 6 weeks, and it's always a Monday through Friday. And yes, we do have people from all over the country that fly in for the class or drive or whatever the case may be, and they all usually just stay at the Spring Hill Suites. We make it really easy. We give you a discounted room rate. We feed you breakfast and lunch. There's a free shuttle from the airport. So we make it about as easy as we can for you to come to class. You can walk right out of your room and into the training room. Hopefully, with clothes on. But so it makes it real easy, and there's lots of stuff to do around the area as well. So yeah, and here's what it looks like on the inside. Now this is a pretty full class. The average size class is about this. It's about 15 to 20 folks, and it's a nice size. It's not too big. It's not too small. You'll have good interaction with people. A lot of people will ask questions that you might not have thought of. And as I mentioned, you actually have certified medical revenue management instructors. So people that have been certified by our training program are now doing the training program. And the lady that you see right there up front, that is Cynthia Anderson. She is one of our lead trainers. She is actually a licensee from Arizona, and she helps us with the training. And she is able to be very proactive with the material. Okay, so what I mean by that is she's not going to teach you guys something that she knows is not working. She's out there in the trenches doing it herself. And so she gives us constant feedback on what's working and what's not, and we are always tweaking our training to make sure that it's the best that it can be for our class. So you got to come to the live training. You know, if you decide to join us, it's not to be missed. Also, you have hands-on learning that you have in the class, hands-on with laptops. You get to learn the system. You guys will actually be filing claims by the end of the first day, believe it or not. We have you filing claims, medical claims, by the end of the first day with a laptop. I realize I'm running a little bit behind on time. I didn't realize what time it was. So real quickly, this is the licensee support site. This is a screenshot. Hours and hours of recorded webinars and videos and all kinds of stuff on there to continue your education. This is something that you have unlimited access to for life. You never have to pay extra for it. It never expires, never goes away, and you can really get, you know, in-depth more education after you've gone through the live class. Now, if you go to the live class and you decide that it's not for you, here's how it works. You can go through the entire live class, and for any reason, if you don't think this business is going to be a good fit for you for some reason, just let us know, and you'll receive a full refund of your license fee. Okay, that's how much we believe in the quality of our training, because we've been doing this for a long time, and we've seen time and time again people that are just blown away that go through the training. They show up on Monday thinking it's just medical billing, and then they leave on Friday completely blown away at the possibilities of the different services and different marketing methods. Our next live workshops are September 12th through 16th. That's right around the corner. And that one, we do actually still have a few seats left. If you guys want to try to get into that one, we'd be certainly, you know, happy to try to accommodate you. And then if you're waiting till October, it's going to be October 24th through 28th is the next class. So you can call us 866-565-8413. And that is it. So be sure to join us next week when we should be, the webinar should be hosted by Patrick and Eric again, I believe. So it'll be back to normal next week. So anyway, thanks for joining me, guys. Have a great rest of your day. Bye-bye.